There is a ton of news to get to this evening, but I want to start by going back to the year 2019 on the small island nation of Samoa. That year, 1 year before the global pandemic, Samoa was experiencing its own pandemic.
This is the biggest increase in deaths we've seen since records began. The figure of 32 dead is up from 25 only yesterday.
These hospitals aren't designed to deal with this, and I think the minute you're getting hospitals running at 200% and 300% capacity, I think that speaks for itself. It's incredibly serious.
The outbreak that doctor was talking about there was measles, a disease for which vaccines have been available for more than 60 years. But in 2019, an entirely preventable outbreak on Samoa killed 83 people, most of them children under the age of 4. Why? Why was a preventable disease spreading like wildfire and killing so many children? Well, 1 year prior to that outbreak, 2 infants in Samoa died after nurses accidentally mixed their vaccine doses with another drug. It was a horrible tragedy, and it was one the American anti-vaccination movement sought to exploit. The anti-vaccine group Children's Health Defense jumped on the incident to stoke skepticism about vaccines in Samoa. And during that time, measles vaccination rates for infants in Samoa went from 92% in 2013 to just 40% by 2018. The man in charge of that anti-vaccination campaign, the leader of Children's Health Defense, was Robert F. Kennedy, Jr. He personally traveled to Samoa as an honored guest of the Prime Minister. Kennedy told the local papers that the Samoan Prime Minister shared Kennedy's concerns about vaccines. And right around that same time, the Prime Minister halted the country's infant measles vaccine program. All of that created the conditions for Samoa's deadliest measles outbreak in generations, which resulted in the deaths of dozens of the island's children. And the man who ran that deadly anti-vaccination campaign has just been named by Donald Trump to be the next Secretary of Health and Human Services, where he will oversee everything from vaccine and drug approvals to children's health to the Center for Disease Control and Prevention. Trump has already promised to give RFK Jr. a broad mandate when it comes to America's health.
Robert F. Kennedy cares more about human beings and health and the environment than anybody. I'm going to let him go wild on health. I'm going to let him go wild on the food. I'm going to let him go wild on medicines.
By now, you've probably heard all about RFK Jr.'s vaccine skepticism. Over the past year, he's gone out of his way to try and claim that he is not anti-vaccine, while also saying things like this.
You've talked about that the media slanders you by calling you an anti-vaxxer. And you've said that you're not anti-vaccine, you're pro-safe vaccine. Difficult question. Can you name any vaccines that you think are good?
I think some of the live virus vaccines are probably averting more problems than they're causing. There's no vaccine that is, safe and effective.
Okay, so he's pro-safe vaccines, but also there's no vaccine that is safe. So Kennedy's not just against all vaccines, he's just against the ones that currently exist. Kennedy's dangerous health claims go way beyond vaccines. Since 1945, local governments have added fluoride to U.S. drinking water in order to stop tooth decay, especially in young children. It's considered one of this country's greatest public health achievements. But Kennedy has repeatedly expressed skepticism about putting fluoride in the water and indicated he might encourage local municipalities to do away with their water fluoridation programs.
On January 2025, we're 3 months away here. What would you actually do in your position inside of the White House?
I think fluoride is on its way out. I think the faster that it goes out, the better. I'm not going to compel anybody to take it out, but I'm going to advise the water districts about their legal liability, their legal obligation to their service zones.
Just to be clear, there are real consequences to removing fluoride from the water. Stat News reports that the city of Juneau, Alaska, removed fluoride from drinking water in 2007. Research showed that dental procedures related to cavities increased after Juneau got rid of that fluoride, particularly among children in socioeconomically disadvantaged families. I would go as far as to say that community water fluoridation is probably our best health equity-oriented public health intervention that we have, said Jennifer Meyer, a nurse and professor of health sciences at the University of Alaska Anchorage, who led that study. RFK Jr. has also promoted fake cures for COVID, like ivermectin and hydroxychloroquine, cures that have caused severe injury and death. Kennedy has promised to dismantle our healthcare infrastructure through massive purges. He recently told an audience that he plans to fire 600 employees from the National Institutes of Health. And he's got plans to gut other key departments as well.
Clearing out the corruption in your terms, would that mean clearing out the top level federal service workers that are currently at the FDA and the CDC?
In some categories, I would say.
What does that look like? Yeah.
In some categories of workers, there are entire departments, like the nutrition departments at FDA, that have to go.
Just to be clear, the FDA's nutrition programs focus on things like preventing chronic diet-based diseases and regulating what foods can call themselves healthy on their packaging. So RFK's fixations are, by and large, somewhat fringe and conspiratorial, but they also share an important feature. Whether it is spreading measles in Samoa or taking fluoride out of the water or ending COVID vaccine requirements, they all reveal a distinct disinterest in the public part of public health. People like Robert F. Kennedy Jr. prioritize the individual choices of eccentric ideologues, many of them wealthy elites, over the health of society at large. And the people who end up suffering are disproportionately the poor, the weak, and the marginalized. That is what is at stake with this appointment. Turn now to Michelle Goldberg, the opinion columnist at the New York Times. Michelle, thank you for being here. You had firsthand field experience covering the RFK Jr. Campaign for president. I want to remind everybody of this very useful assessment you made of those who supported RFK and indeed what his candidacy was about. What brought all the supporters together was a peculiar combination of cynicism and credulity. The people I encountered believe that they are living under a deeply sinister regime that lies to them about almost everything that matters. And they believe that with the Kennedy campaign, we might be on the cusp of redemption. How complicating is it for our democracy to have someone like Robert F. Kennedy installed at a health agency with so much influence, to have someone who has spread misinformation and disinformation actually now in the government itself?
I mean, profoundly, both in terms of, sort of actual health outcomes, but also in terms of this broader destabilization of any common sense of what reality is. And I think that the credulity part is in some ways as important as the cynicism, right? Because they'll sort of say, don't believe anything that the government is telling you about the efficacy of vaccines, or, Kennedy has raised questions about whether HIV really causes AIDS. At the same time, there's all these kind of quack remedies, ivermectin, hydrochloroquine, raw milk that they're willing to accept with very, very little evidence, with only the sort of anecdotal stories that are passed from one person to another. And so it's this perfect storm, both for really bad health outcomes, but also for, again, this kind of, we're entering this upside down world where the people who are atop many of these various agencies, if Trump gets his way, are people who are hostile to what those agencies have traditionally done.
Yeah, I mean, the CDC director, Dr. Mandy Cohen, shared her concerns about the RFK Jr. pick and said, even without changing one regulation or one piece of guidance, the sharing of misinformation from a place of power is concerning. And that's it, isn't it? Like, you put RFK Jr. in a place of power, it undermines settled science in many ways. It undermines public health, but it also changes the way the American public thinks of its government, right? And by the way, the long-term effects of this, even post-Trump, could be incredibly damaging to just the notion of public health and a government that is there to to guard the safety and well-being of its citizens.
Right. I mean, in some ways, you're going to have a sort of inversion of distrust, because you'll have Trump voters who will suddenly believe everything that comes from the government. And, whereas I think Biden voters with good reason will be quite skeptical. I mean, if I had my kids are older now, if my kids were very small, I wouldn't trust some sort of new vaccine schedule that came from this government. Right. I would take my kids to another country and get them treated according to established protocols.
Right, and so then you have mistrust on both sides, and what's the net effect of all of this? You know, in